Crystal, and I'm going to be informing you guys about the Kawasaki disease. It is a disease named after the Japanese pediatrician named Tomisaku Kawasaki. He discovered the illness in 1967, and it is understood as a rash and fever illness of early childhood in which a coronary artery aneurysms may develop in up to 25% of untreated children. In many cases, this disease can be fatal. In my speech, I'll inform you about the disease's history, symptoms, and treatments. And there's a lot of information that I would like you to know for future reference. The history of the disease. Tomisaku published his first English report of 50 patients with the disease in 1974, and he saw his first case of the disease in January 1961, and he published his first report in Japanese in 1967. The most significant controversy in the 1960s in Japan was whether the rash fever symptom complex described by the disease was connected to cardiac complications in a number of cases. In Japan, 1,000 out of every 10,000 kid has the disease, and here in the U.S., 1 out of 10,000 kids have the disease. And it's most common in boys under the age of 6. The symptoms, it usually has 2 phases. The first phase, which can last up to 2 weeks, usually involves a fever of 104 and higher, and it can last up to at least 5 days. They develop symptoms like bloodshot eyes, chapped lips, the strawberry tongue, which looks like a strawberry. During the second phase, which usually begins within the 2 weeks of when the fever started, the skin on the hands and feet starts to peel in large pieces. And also the child may experience joint pain and a lot of vomiting. The treatments, usually a child is treated with intravenous doses of globulin, an ingredient of blood that helps the body fight infection. And they usually give the child a high dose of aspirin to thin the blood and reduce the risk of heart problems. In conclusion, I think this is dangerous and people should be more aware of and educated on, because it's a really horrible disease that can happen to anyone. My brother had the disease, and I think people should, I don't think anybody should have the disease. Thank you.